Is it even possible to adequately and safely take care of 3 critically ill patients? Being tripled in ICU is becoming much more frequent for many reasons. Let's discuss the reasons why, plus how you can manage your 3 critically ill patients. Welcome everyone to the Momma Nurse channel. I'm Vanessa, and here we discuss all things nursing, motherhood, and lifestyle. Make sure you leave a like on this video, and don't forget to subscribe to the channel, and make sure you hit that notification bell so that you don't miss out on any uploads. It's not a new trend to be tripled in the ICU. However, in the past, you used to be tripled with step-down patients who were just waiting for a bed on either a med-surg or a PCU unit. When you were tripled with these type of patients, the charting requirements are much less, so it made it easier and okay to manage. Now, your triple assignment can consist of 3 critically ill patients, all still being considered ICU and all still requiring every 2-hour charting, assessments, and all the care of a typical ICU patient. So why is this happening? Well, for many reasons. The most obvious reason would be hospitals are still being short-staffed. Even with so many travelers out there, staffing is still an issue. And now that pandemic rates have decreased back to regular travel nurse rates, we're seeing this increase in staffing issues once again. Patients are also getting sicker and requiring more monitoring. So the average patient that used to go to a PCU or a med-surg unit, they're now requiring IV drips and things that need to be managed and monitored in the ICU. Now, when you are a registered nurse, how can you safely and adequately take care of your patients? Here are some tips. Number 1, get as much info as you can during shift report. If you need help with shift report, please check out my shift report video here. I do also offer one-on-one shift report coaching. That way you can get adequate shift report. Think about it. When you're tripled, you're not gonna have time to sit down and dig through 3 charts and get everything that you need to get. So if you're able to get this in shift report, it will help you out. Now that brings me to step 2. Take the time to look over your charts, check current labs, vitals, orders, and at least the most recent MD note. I do this at the start of every one of my shifts, but think if you're tripled, you may not be able to dig as deeply as you usually do. Tip number 3, take it 1 patient and 1 task at a time. Tip number 4, prioritize your tasks and your patients. This will help you stay on track so that you can adequately and safely take care of your patients. Tip number 5, try your best to stay on top of your charting. This can make or break your triple day. Tip number 6, cluster your care and medications as best as possible. And tip number 7, take it 1 moment at a time. You can and you will get through it. If I'm being completely honest, being tripled in the ICU setting sucks, but it is manageable, especially if you have a strong team around you. Focus on your patients, figure out how you can keep them safe, and complete the most important or critical time-sensitive tasks first. Always remember to breathe, take your lunch break, and use the bathroom no matter how busy you are. As always, I hope this information was beneficial to you. Make sure you leave a like on this video. Don't forget to subscribe to the channel, and until next time, all love.